Hey guys, what's up? It is Wednesday and it's time for our weekly drop. And today I want to focus on the role of the LPN. And I want to teach LPNs, if you don't know already, how to master your shift as an LPN. All right. In long-term care, some might think that LPNs, they just there to push pills, and that is not true. All right. So I wanted to go about and just say, when you are LPN, just as you was to be like a unit manager or in a DON position, you still want to try to manage your day the day before, right? You want to kind of have an idea on what needs to be done when you get to work. Okay, so follow these tips and I promise you, you're going to see a major improvement in your time management. You're going to see a major improvement in your productivity, and you're going to also see a major improvement in your leadership style, okay, and your leadership skills. So when you arrive to work, one, you're going to always get report. Okay, always get report as the LPN. All right, it's frustrating sometimes when you can get to a facility and you get report and everything is like, oh, everybody is fine, and then 10 minutes later everything is not fine. Okay, you walk into an absolute shit show once that once you start that shift. So I want you to start thinking about that when you're getting report. If you utilize PCC, I teach my LPNs, use your 24-hour or shift report. Okay, and that's what you should be utilizing when you're giving or receiving report. All right, this is to make sure that you don't miss anything while you're giving report. Okay, and that happens frequently. Okay, and this is why I like to utilize my nurse report sheet that I made for my LPNs. This because it kind of hits on each area, from patients to blood sugars to oxygens to Foley catheters, antibiotics. It just touches base on so many different issues so that you don't miss. Okay, but one, so one, you're going to get report. Two, you're going to count your narcotics. Okay, count your narcotics. And make sure when you are counting narcotics, okay, this is very scary, very dangerous, okay? Never trust anyone with your narcotics, okay? So if you are coming on to your shift and you are counting your narcotics, not only do you want to pay attention to the narcotics, you want to look at the actual sheet. Okay, and I am telling you this because this had happened to me when I first became a nurse. All right, I was counting and I wasn't looking at the sheet, and that's how I became obsessed with not only paying attention to what I have on hand, but also paying attention to the sheet, because the person who's running the numbers can easily say a number and it's not accurate to what you are actually counting. So pay attention to what you are counting, like your narcotic count, like your narcotics. Okay, Bilquis Ali is on oxycodone. Okay, yep, okay, and it matches. Make sure it matches, because there's also been times where you might think a pill is inside of that that foil and actually isn't. So pay attention and take your time when you are counting your narcotics. All right, I've even been in situations where I've had to notify authorities because when I went to go count before, and this was, I was a manager and I was counting the cart as a supervisor. The vials were all there, but the Ativan were taken out of the vials. All right, so someone had actually started lifting up the top of the Ativan, the top to the Ativan, and was actually withdrawing the Ativan from out of the vial. All right, so pay attention. Don't just look at the numbers of saying, okay, there's 12 vials there. Yep. No, go actually visualize that. All right, I promise you, you will not regret it. Take your time before you accept those keys. Okay, so after you finish your narcotic count, then you're going to get your CNAs, make their assignment sheets. Okay, if you have CNAs on and they don't have assignment sheets, make an assignment sheet for them. Okay, and make sure that the assignment sheet is fair across the board. Okay, you might have a round that might have 7 Hoyers, right, or 7 totals, and then another CNA might only have 7 walkie-talkies. So you want to make sure that it's fair, all right, if you possibly can. All right, so look at that when you are making your assignment sheets. Be sure to give your CNA's report. All right. This is one of the things that CNA says that happen the most, that they don't never know what's going on with their residents, or I didn't know this. And then that's how we have negative outcomes, because they wasn't relayed pertinent information in order to properly care for that resident. So be sure that you are giving your CNA's report, and make sure that they are utilizing not only your report, but checking their care plans or Cardex, whatever system you use, to ensure that they are then following that plan of care. All right, once you get report, always talk about your high-risk residents, such as residents who you're high fall risk, residents that might be on oxygen, residents that might have Foley cath, residents who are feeds. Talk about your high-risk residents, all right, because the more they know about these residents, the better your shift is going to go, okay? You can plan your day out according to that, okay? So how many do we have on today? Oh, all right, well, so-and-so has an appointment. So-and-so is going to therapy. So-and-so is a feed. You start giving that information to them so then that they can plan out what they need to do also. Okay, the other thing, once you have given them report, then I want you to round. Okay, take a quick round on your residents and make sure everybody is breathing. Make sure everybody is breathing, okay? Because sometimes you might get to work and you might not get to that one resident for like maybe 15, 20 minutes or hour into your shift, okay? Make sure everybody, you just lay eyes, okay? If they're sleeping, just make sure you see their chest rise and fall, okay? Make sure that if they are supposed to be in a low bed, ooh, this bug trying to come in here, that if they're in low bed, make sure that they have their low bed. Make sure that everybody has their call bells in place in the event that they need to reach you, okay? And then from there, you're going to start your medication pass. But when you start your medication pass, find out who your diabetics are, okay? Who are your diabetics? Because of course you want to get those residents first. All right, you want to make sure that you have their blood sugars first. You want to make sure that you're giving them insulin. So you want to make sure you have a idea of what everybody needs on your unit. And the thing that you can do is you can pull a order listing report and find out who your blood sugars are if you don't know. A lot of times night shift might not know who day shift blood sugars are, or the next shift. All right, so you can always pull your order listing report and find out who might be on blood sugars. All right, because you want to make sure that you get those that information so that you don't have to keep stopping in your med pass if you see those trays come up like, oh my god, I gotta run and get this blood sugar. Don't give them that tray. Let me get their blood sugar first. Trust me, I know, I've done it. I started out as an LPN. And then once you do that, find out your oxygen residents, whoever has multiple eye drops. You're going to be going in those rooms multiple times. All right, so these are some of the tips I want you to start thinking about when you're going into start your shift. All right, 1, get report. 2, count your narcotics. Okay, verify your narcotics. All right, whether they are and the ones that are in the refrigerator. Don't just count the vials. Make sure you're actually looking at the vials. All right, 3, give your CNA's report. 4, make your assignment sheets for your CNAs. 5, get your blood sugars. 6, and then start your med pass. All right, and then if possible, document as you go. All right, now of course there are going to be things that you're going to have uneventful days where things just might be a total shit show, right? You come in, you have a fall. Damn. You come in, you got to transfer somebody out to the hospital. You come in, oh my gosh, the doctor's here around. You come in, therapy is saying, oh, I need so-and-so. All right. So try to have a plan in place to manage your day. All right. You will find that when you are prepared, remember, planning and preparation produces positive outcomes. All right. There's nothing more frustrating when you just feel like you're constantly on a med cart where, oh my goodness, I'm passing meds for my 30 residents. And I sit down, damn, here's lunchtime. And I know because I'm slow as hell when I pass meds. Okay. So I get it, but I do feel more confident and I feel less anxious when I have a plan for my day. I have a plan to say, okay, these are the things that I need to take care of. These are the appointments that have to go on. Oh, I have a discharge coming up. Oh, this is the person's time for therapy. So I feel more confident and more relaxed when I know the things that I need to get throughout my day. Now, if I go in there and I don't have a plan, I don't know the residents, and I do get a little bit anxious. So incorporating a plan is going to effectively help you produce the outcomes that you want. And utilize a report sheet, guys. If you don't have one, check it out on my Etsy store. It's a nurse report sheet. It's simple, and you can write your resident's name, their diagnoses, if they have oxygen, blood sugars, if they're forest, if they're on antibiotics, if they have Foley catheters, literally everything you think you want to know about your patient, you can actually write it on that form. And that's another great way to give your CNA's report as well. All right, so that's what I wanted to share with you today. Remember, DONs, you are only as strong as the team that you have. All right, the more that your LPNs know, the more they grow. All right, the more they grow, the less you're going to have to do. All right, so I hope this video helps. Like, comment, and subscribe to my YouTube channel, and please let me know if there are any topics that you would like for me to talk about. And I'm also going to be doing the CNA, how to manage your shift as a CNA next week, and it'll be tagged to this video. All right, have a great day, and I'll see you next week.